Nigeria, hello Africa, welcome to yet another exciting episode of the Voices for Self-Care podcast, the #1 show advocating for self-care in Nigeria. If you're just joining us on the show, a very warm welcome, and if you're joining us for a while, thank you again for joining us, and make sure you subscribe, turn on your notifications so you get notified anytime we make a post. Today is going to be another engaging conversation about self-care implementation in Nigeria. We are going to be talking building sustainable partnerships, funding and commodity security for national and subnational implementation of self-care in Nigeria. I have a very special guest who's going to be delving into this conversation with me. When we come back from the break, I will let you know who it is. We'll be right back. Welcome back. This is the Voices for Self-Care podcast, and we're talking building sustainable funding, partnerships, and community security for self-care implementation at national and subnational level in Nigeria. And to delve into this conversation with me is a phenomenal woman with over 2 decades of experience working across both the public and private health sectors. She is the National Family Planning Analyst in the UNFPA Country Office, where she provides technical expertise for scaling up family planning programs, demand generation, and service delivery. She offers technical backstopping and advice to partners on strengthening FP initiatives and provides technical guidance in developing and implementing FP protocols, policies, and training modules. This woman is a core key stakeholder in the public health sector, and she has played roles that involves conducting technical updates, training, and mentoring for partners in relevant clinical and technical areas. I'm talking about no other person but this exceptional, phenomenal Dr. Ummul Bajoga. I hope I got the name right this time.
Yes, you did.
Thank you so much. Okay, so backstage, before the show started, I was really struggling trying to get the name right, and I do hope I got it right this time.
Yes, you did. In fact, it's quite interesting to see how people pronounce my name in different ways.
I can
imagine. So I'm glad you got it.
I can imagine. Welcome to the show. It's such a pleasure having you here.
Thank you for the invitation. I'm glad to be here.
And I really do look forward to all the insightful conversations we'll have, especially relating to this topic when it comes to funding, because we know that the NGO space really hits a backlog, when the USAID funding, because of the USAID funding cuts. And because of that, we are concerned about how this has affected self-care implementation in Nigeria. And that is why I feel like you'd be the best person to have this conversation with on the show. And this brings me to my first question for you. With your experience in UNFPA, what would you say is a very innovative financial model that you have successfully applied to self-care programs in other countries that you think Nigeria could adopt?
So thank you very much for that question. So what we use in Nigeria is we use the pooled procurement process. And we use the pooled procurement for procuring all family planning commodities, including the self-care commodities. What we mean by pooled procurement is that we have a basket fund. So there's the National Contraceptive Basket Fund, where we pool the resources from the different donors and use it to procure. And this is used to procure a different mix of commodities based on what the country needs. So that's what we do. But there are also other models that have been employed. We have the disbursement, the performance-linked models, whereby funding is provided based on reaching certain targets. And then there's also public-private models, public-private partnerships, whereby we have the private sector playing a key role in procuring commodities. So these are some that are being used. But the pooled procurement that we've used in Nigeria, we've used it since 2011, and it provides a lot of transparency. So you're able to see at a glance who is procuring, who has made commitment, who has actually fulfilled their commitment, what is being procured, and you can look at the trend over time.
Yes. That's really interesting. So let's talk about barriers. Have you observed any barriers that prevent the implementation of self-care interventions at the subnational level and national level when it comes to financial barriers? Yes.
So what we say usually is that there is no product, there is no program. And when we talk about barriers, the first thing we'll have to talk about is financial barriers. And we know that right now there is a lot of funding cuts that's going on due to many reasons, one of which is the changing political climate, and we have some partners that were contributing in the past and are not contributing anymore. So it's important to say that. And when we talk about barriers, not just financial, we also look at geographical barriers. But why self-care is really good is we're able to overcome the geographic barriers. If the clients have the commodities to take home, it means they don't need to spend transportation to go back to the health facilities. They can provide that care by themselves at home. And other things we look at when we talk about barriers is that right now we have a lot of global situations, we have wars. So some of the donors are diverting their funds to that. So now is the best time, if not any, to talk about sustainable financing so that we would be sure that we don't have stock out and we have commodity security.
Speaking of sustainable financing and accessing funding, could you walk us through some of the common challenges that you think Nigeria faces when it comes to accessing UNFPA funding for self-care? What are the typical bottlenecks that you see, and how do you think we could overcome this bottlenecks?
Okay, so for self-care, usually what we use right now is the DMPA SI, if it's self-injected, and we get it from the funding new and underutilized commodities. So for countries to key into that, we need to have a central coordinating mechanism. We need to have an M&E program to make sure it's being used, properly tracked, and also a plan for scale up. So Nigeria has benefited from this for a while. However, we have made so much progress that we may soon not be able to key into that.
Oh, right.
And then if that's the case, it means we are now going to procure self-care commodities from the basket fund for other commodities. Now, how this is usually done is we have a national quantification exercise which is led by the Federal Ministry of Health, and we have different partners working in the space that come around. So we have the first part, that's the forecasting, where we look at data, we look at we look at different forms of data, we look at consumption data, we look at population data, we look at socio-demographic data, and then based on that we forecast what the country needs based on the methods mix. Then we also do supply planning, which is, okay, if this is what we need, how soon should we get it? Because with supply chain, you have to have the commodities at different times. You can't have them all at the same time, so they don't all go into the warehouse, and then there's a backlog on how to move it. So that's what we do. Okay,
so let's talk about commodity security. In Borno State, there is a comment or feedback from one of the Self-Care Advocacy Network secretary, the secretary of the Self-Care Advocacy Network, saying that some products, self-care products in some humanitarian states like Borno State are being diverted. And I would like you to take a look at this video and give us your insight on how to prevent this from happening. You know, just give your comments on the video, and then let's see how these products can really get to those who need it the most. Okay. Take a look at this video.
Thank you. Thank you. I'm speaking from the community reality. Yes. There are facilities, agreed. I know there are facilities. But reality is, let me say this, there are some facilities, even the family planning pills we are saying, if you go, you have to buy. That is the truth. In some community facilities. So let's stick to what we are saying. Women going for labor in most of facilities, they will say we've run during labor, the woman have to, or the husband or the lady have to go to chemists around that facility to buy drugs. So sometimes that cost of transport, cost of buying drugs will make them to, I better stay at home and then use the local traditional battery. I'm not saying this is the only reason, but let us also consider this.
Do they pay the TBAs?
Most of the times it's nothing serious.
How much is it?
Well, I don't know, but it's not as expensive as paying transport and buying drugs in hospital. We will say in theory that all ANC drugs are free, but honestly, in some facilities, people buy. Sometimes facilities run out of stock, so you have to buy.
Thank you so much. So did you get what he was saying there? His concluding statement says, in theory, ANC products are supposed to be free, but in some facilities they buy.
Okay.
Your comments, ma'am.
So I'll start by saying that the federal government has stated that family planning commodities are provided free in all government-owned facilities nationwide. Now, when we come back to states, we now talk about the availability of consumables at the health facilities. So specifically for commodity security, there are certain things that UNFPA has put in place whereby we track the commodities from when the order is placed. We have different tracking tools. We have a shipment tracker to when it comes to the central contraceptive warehouse, and then it goes to the states. And to talk about commodity diversion, I would like to say it has to do with different stakeholders.
Right.
So first is in humanitarian settings, we have to talk about having coordination meetings, which will be led by the government and have different stakeholders involved, of which UNFPA is one. We have procurement, supply chain management, technical working groups in different states, and these are the ones that are primarily tasked with that responsibility. We also need to talk to communities so that communities will be accountable. They know that these commodities are free, they know they're coming into the facilities and be provided free, so that they would also help in raising awareness. And then we have to talk about having monitoring mechanisms in place, also talking about using the ongoing community mechanisms. So that's in general what we can do. But we do know that there is a lot of insecurity, which may oftentimes affect how, cause a difference between how things are supposed to work and how things are actually working.
Thank you so much for that response. Very timely, I would say. Let's just talk about the role of private sectors, really. How would you say we could better engage private sector partners in funding self-care initiatives, and what potential return of investments could you use as incentive for these partners? Because we know that one of the challenges for private sector's partnership, or for private sector partnership rather, is the return on investment that they can potentially get, right? So what would you say, how can we better engage them?
Okay, before I address that, I think I want to talk about more what UNFPA is doing in the humanitarian settings.
Right.
Then I'll come back to your question on private sector.
Go
So
ahead.
specifically for UNFPA, the support we're offering in humanitarian settings, we have to start from the national quantification, which I talked about earlier, whereby we quantify all the family planning commodities for the nation, including the ones going to humanitarian settings. And our quantification will include our forecasting, what should be bought, and our supply planning. Then after the commodities have come into the central contraceptive warehouse in Lagos, that's in Oshodi, it's handed over to the government. When that is done, we support the long-haul distribution. That's the government taking the commodities from Oshodi to the different states. When that is done, it now goes to the state warehouses. So at the state warehouses, we help in taking stock of the warehouse. How adequate are they to make sure the commodities are kept in the right place? That's the positioning in making
the right
sure,
conditions.
thank
as
you,
well.
in the right conditions, like temperature, like how they're being stocked. Then when we have that, we now support the last mile distribution. So before you do last mile distribution, you need to have a plan. That's, you see, this commodities, this quantity needs to go to that place based on what they've requested, what they're using, and the space they have at the health facilities. And we also support the capacity building. When we talk about capacity building, we're saying use of our tools. For us to do a good quantification, we need accurate data. And if the data is incomplete, if it's not of good quality, it means we're doing wrong quantification. And then we also train them on M-Supply, which is an electronic warehouse management tool that helps us get visibility from our central warehouse to the state warehouse, and also see what's happening at the service delivery points. So we're able to see that. We're also training them on service delivery, which is among the things we do. So we do have structures in place. And lastly, we do the last mile assurance, which ties in what you said about commodity security. That is, we need to ensure that the commodities get to those that need it,
them the most,
because we're keeping in mind that these commodities are donated, and we want to make sure that the right beneficiaries get it. So there are different interventions that we do that tells that, but ultimately all stakeholders have to come on board. We have to start by raising awareness of where we are on this.
Thank you so much, and kudos to UNFPA. So you are preaching and advocating for awareness accountability, and all stakeholders coming on board to
Yes.
ensure that the right commodities get to those who need them the most. Thank you so much. We'll go on a short break right now. When we come back, the show continues. We are talking building sustainable funding, partnerships, and commodity security for national and sub-national self-care implementation in Nigeria. We'll be right back. Welcome back. This is still the Voices for Self-Care podcast, and we are talking building sustainable partnerships, funding, and commodity security for national and sub-national self-care implementation in Nigeria. And to have us take us deeply into this conversation is Dr. Ummul Bajoga from the United Nations Population Funds. This has been an exciting conversation so far, ma'am, and I really appreciate you for your insights. Thank you again. Thank you again.
You're welcome. Bajoga.
Bajoga. Oh my God, I thought I got it right the first time.
You got it right the first time,
and I got it wrong.
Mm-mm.
Bajoga.
Yes, please.
Bajoga.
Yes.
Thank you so much, ma'am.
You're welcome.
You know, unique names like this are really hard to pronounce.
Yeah, it's a tongue twister.
It is, right? Okay, so ma'am, let us talk about domestic resource mobilization.
Okay.
What role do you see this domestic resource mobilization playing in sustainable funding for self-care programs, especially at subnational level?
Okay, so thank you for that question, really, because sustainable financing as a whole is one of our niches that we work in United Nations Population Fund. And domestic resource mobilization is a key component of that, whereby later we'll talk about the other components. But specifically for domestic resource mobilization, we have supported the government in developing guidelines, the national guidelines for state-funded procurement of family planning commodities. Now, prior to the development of these guidelines, the funding for family planning commodities, including our self-care commodities, comes from donors. That's the United Nations Population Fund. We have, okay, I'll not call the donors, come from donors, UNFPA and other donors, including the government, and was the government at the national level. The states were not contributing. However, with increasing funding gap, we saw a need to have this document. And this document is a how-to, it's a guideline how states can contribute. And after the development of the document, we've supported the dissemination of the document in 14 states.
Okay.
Following this dissemination, we have seen states actually contribute towards procuring their commodities. We've had success from we've realized about $300,000 US dollars, of which has been used to procure commodities. Now, the commodities that are procured are based on what the state wants. So the state looks at its method mix, they look at what it is they want to procure, and they also keep in mind what interventions are going on to procure the commodities. So that's one thing we've done. Additionally, besides the guidelines, we're also working on smart advocacy for domestic resource mobilization, and that has been done at national and at subnational levels. So specifically for subnational levels, we've done this in in Gombe, Ebonyi, and Ogun states, and that's still ongoing. And we've seen it really realizing results. And finally, I will talk about how we're working with the trackers we have supported the states to do. So, you know, if you're doing, for transparency, it's always good for you to track where the funds are going. So at the national level, we have a national contraceptive basket fund tracker, which we
National Contraceptive Basket Fund Tracker.
Yes.
Okay.
Which tracks the year that contributions are made, the donors that have pledged, the donors that have made contribution, the commodities that have been bought, the funding gap, and also the implication of these gaps. So this is domiciled at the Federal Ministry of Health, and we're supporting them on that. Then at state specifically, we have supported the development of the state-based family planning financing trackers. Now, the difference between the two trackers is that while the first is nationally on procurement, for the state, it takes everything in place for family planning, not just procurement, but we also have service delivery, yes, and all the other aspects, including advocacy. And this, so we are creating the capacity of the state to have this tracker, and then they update it themselves and they domicile it. So this is the third year we're doing this, and so far you can pick this and see, okay, this is what's in the operational plan, this is what has actually been done, and you can track.
How about private sectors? Is there a way to track the level of support gotten from private sectors?
Okay, so thank you very much for the question regarding private sectors, because actually Hitherto, we've not really brought them into the fold, but with the support of, or rather with the leadership of the Federal Ministry of Health, we do have a private sector subcommittee. And what we've also done is we had a high-level family planning forum where we brought, where we had the private sector that were there. And one of the key things we discussed with them was the investment case for family planning. Now, we've supported the development of an investment case and sustainability plan for family planning from 2024 till 2030. And this has presented different scenarios and shown what the return on investment on family planning is. We have the moderate scenario that says, okay, if we are going to get modern contraceptive prevalence to 27% by 2030, and we're also going to reduce unmet need by 50%. That was the moderate scenario. And then with the aggressive scenario, we said, okay, the scenario is to get the modern contraceptive prevalence rate of 36%, and then you reduce unmet need by 75%.
Right.
Now, with these scenarios, we've seen that in the moderate scenario, we have about $69 return on investment for every dollar invested in family planning. Right. And then we've also seen that there is I need to confirm that figure, $120 investment for the aggressive scenario. Now, we also see that in the aggressive scenario, you have over $500 million that will be saved from other healthcare interventions. Keeping in mind that if the woman does not become pregnant, it means you're not paying for antenatal, you're not paying for immunization, you're not paying for
That's like the ripple effect.
Yes, that's like the ripple effect. So when we have these figures and we take it to the private sector, it's easier for them to relate. And we know that private sectors have their corporate social responsibilities, and sometimes they need to know exactly where to key in. And to also mention that at the National Family Planning Conference, we're able to get the private sector to commit to make FP 2030 commitments, which we know are global commitments that can be tracked globally towards family planning. So this is really a huge achievement that the private sector is not just talking the talk, but we can see them really, providing support to family planning.
Right. This is really impressive because we know that one of the barriers to really accessing private sector partnership really is some sort of return on investments that they can get. So is there a policy, or is UNFPA working on any policy to ensure that the private sectors are compensated and encouraged to support self-care interventions?
So as at now, what we do have has to do with, for the private sector, what we do has to do with our total market approach policy and our investment case. But regarding what you said, we're working closely with PVAC, and they talk about putting incentives in place for the private sector, especially towards local production of commodities, how we can encourage our local manufacturers to produce some of the commodities in-house.
Right. This is really interesting, and it's exciting to see, because we now know that self-care implementation, we will not just phase out, right, because of any funding bottlenecks. And we are rounding up right now, and I have one last question for you, still taking us back to the humanitarian setting a bit. What measures is UNFPA taking to strengthen supply chain subnationally, especially at humanitarian settings? I think you've answered this before, so I think we're done on that. But do you have any last recommendations, any last words you want to say, any last recommendations you want to make to ensuring that self-care implementation is properly implemented at subnational level?
Yes, so I think what I want to say is that the United Nations Population Fund is the reproductive health agency of the United Nations. And our vision is to have a world where every pregnancy is wanted, every childbirth is safe, and every young person achieves their full potential. And family planning is at the core of our mandate. We want to support Nigeria to achieve our FP 2030 goals of getting a modern contraceptive prevalence rate to at least 27% by 2030. One way we can do that is through increasing access, where self-care comes in. With self-care, we can get persons with disabilities, we can get people in hard-to-reach places. So this is something that we're really passionate about and we're really supporting. And we're key partners in the progress of self-care in Nigeria.
Thank you
and
so
globally.
much, Dr. Ummul. This has been really exciting, and I'm happy we finally had this conversation. Thank you so much. Now, if you've been watching this show for the last 3 episodes, you know what time it is. It is time for our favorite game of the show, Two Truths and a Lie. And yes, Dr. Ummul is going to be playing this game with us. Right. Ma, are you ready?
Yes.
So the role of the game is really simple. I'm going to make 3 statements from the National Self-Care Guidelines, and you are to tell me which one of them is a lie. 3 statements about self-care, national self-care policies on self-care from the National Self-Care Guidelines, from any strategy document that's been released, and you will tell me which one of these statements is a lie.
Okay.
Are you ready?
Okay.
Right. The first statement is, over-the-counter oral contraceptives are to be made available without prescription for individuals using them. Second statement, the DMPA policy allows for 2 take-home doses for women after counseling from a healthcare provider. Third statement, self-administered injectable contraception should be made available as an additional approach to individuals of reproductive age. Which of these statements is a lie? You have 5 seconds.
Do I get any gifts?
Your time starts now. We don't know, but yeah, of course, there's something.
So the second one is wrong because they're supposed to have 3 take-home doses, not 2.
She didn't even allow me to count it down. Okay. Dr. Ummul, is this your final answer?
Final answer, yes.
Final answer.
Final answer.
Second statement
Yes.
is
It's the lie.
the lie. And the second statement says the DMPA policy allows for 2 take-home doses for women after counseling from a healthcare provider. Final answer?
Final answer.
All right. Now, ladies and gentlemen, what is our correct answer on 2 Truths and a Lie today? The answer is the second answer. Thank you so much. Of course, she's allowed to have 3 take-home doses after the initial administration. Thank you so much, Dr. Ummul. This has been really fun. And
It has,
engaging.
really. We should do this again.
Yes, I'm so happy you joined us on the show today. Many thanks for watching, my viewers. If you have any questions for Dr. Ummul, please make sure you send us a message at the comment section or send us an email at rancoms@gmail.com. That is RANSCOMMS@gmail.com. My name is Oyari. This has been the Voices for Self-Care podcast, and I'll see you next time. Bye. Can we say bye together to the camera?
Bye.